Thank you, everyone, for being here for this event to kick off our 3D mammogram machine and the funding. Thank you so much for being here. I'm the mayor of the city of Fitchburg, Samantha Squailia. I'm so proud to be here and introduce Congresswoman Trahan, who was instrumental for this funding, and just having this 3D mammography here to have this access for our community, especially that make it, that it's difficult to travel and make these appointments in further destinations. So thank you so much for being here, and thank you so much, Congresswoman Trahan.
Thank you. Well, thank you, Mayor Squailia. I so look forward to our continued work together to bring more federal investments to the residents of Fitchburg. I also want to thank everyone for having me here to celebrate this exciting federal investment in women's health care. Thanks to this federal investment and to the incredible work of the radiologists, the technicians, nurses, Betty, this new 3D mammography system is going to help combat breast cancer across the North Central region. And for too long, healthcare costs have been a tremendous burden on working families. I know this firsthand because my father was diagnosed with MS when I was in college. But it's why I support legislation like the American Rescue Plan and the Inflation Reduction Act that puts quality health care within reach for millions of Americans. Right here in the 3rd District, Medicare beneficiaries are saving an average of $1,030 in premiums each year compared to 2020, and even more savings are on the way. The significant reduction in healthcare costs is bringing much needed financial relief to the Commonwealth of Massachusetts, but we just can't focus on individuals when it comes to addressing the glaring needs in the healthcare landscape. It's no secret that many hospitals in the district that I call home, and you all call home, and across the Commonwealth are struggling financially. And recovering from the pandemic is one reason, workforce issues another issue, but also the risks of private equities interference is another one that we're grappling with. Ensuring that everyone has access to the essential, affordable healthcare services at a location that they can easily get to is paramount. That's why I recently put forward legislation to establish an essential health system designation under federal law, so that going forward we can carve out the necessary funding to support safety net hospitals and health systems like UMass Memorial that are providers of choice for people who face social and financial burdens to care. It's a frightening reality that these barriers to care are particularly impacting women. It seems like every week when I'm in Washington, the GOP is announcing a new assault on our reproductive freedoms. That's why today's celebration highlighting a new medical service for women is so important. It's so gratifying. When the team at Clinton HealthAlliance reached out to our office 2 years ago to request this funding to upgrade their mammography machine, it was a no-brainer, as they say in our office. For $450,000 in federal funding, we could provide access to high-quality breast cancer screenings for women in North Central Massachusetts. This upgraded technology will produce more accurate results from screenings. This means that fewer women will have to go through the anxiety-inducing process of a callback appointment, or worse, a false diagnosis. And these screenings will lead to earlier cancer detections, which will allow the incredible doctors in the HealthAlliance system to get to work on treatment and saving women's lives. I'm sure that everyone in this room has been impacted by breast cancer in some way. Tragically, almost everyone in our nation has. Hearing the stories of the brave women that I met with earlier really puts into perspective the difference that having a system like this at your local hospital can make. If it helps, even if it makes cancer patients' lives a little easier by taking 10 or 15 minutes off the commute in the car, if it helps one more woman in Fitchburg decide to go in for a proactive screening, or provides one woman with access to life-saving early cancer detection, I am humbled to know that we all played a small role in that. So now, before we break out that big check, and this, I want to invite a few more people to speak about this new machine and the impact on the community. Senator Cronin was unable to make it today, but today, is Beth Walsh here? I know Beth. Okay. But with Senator Cronin and with Representative Kushmerek, Fitchburg is so lucky to have two dedicated advocates on Beacon Hill and right here in the community who have been able to bring home critical funding to support the community. Representative Kushmerek, I mean, he's been a champion for the people of Fitchburg. I know I am lucky to have him as a partner and a friend. Rep. Kushmerek, why don't you come up and say a few words?
Thank you so much, Congresswoman. At a time where women's health has come under attack nationwide, at a time where the disconnect between healthcare services and the people who need treatment seems to be growing nationwide and even in our own communities, and at a time where maybe cynicism and distrust of federal governing institutions is also on the rise, I think there's a true reason for hope here. And it's not just because there's a big check next to me, but it's because we have an incredible and fearless individual championing for Massachusetts and Massachusetts women and for the residents of North Central Massachusetts, and Congresswoman Lori Trahan. I don't think anybody does it better, and I know that you will go through any hurdle and obstacle and ensure that you'll bring along bipartisan support along the way to deliver meaningful and crucial aid and resources to people in our district. And today is yet a further example of that. $450,000 to save people's lives each and every day. My mother was a 3-term breast cancer survivor, and for the last 25 years of her life, an annual screening and often biannual screenings was a part of daily life and conversation for her. And often we hear in our own community, particularly from people of color and those of low income, the barriers to receiving access to care, treatment, and preventative service can be a major obstacle and in saving lives. And it becomes that much easier for people to say it's next week, it's next month, it's next year when I can next get my screening. And through your support, Congresswoman, you're ensuring that no one ever has to make that decision in North Central Massachusetts. There is an option and there is a treatment center right here at UMass and at Burbank campus, right in their own backyard. Thank you for delivering for the people of Fitchburg and of North Central, and thank you for saving lives.
You don't do this job alone. If I had known on my own, what each hospital needed to just make accessibility or quality of care better, I mean, I would be worthy of all of those words, but I don't. And I want to bring up Steve Roche because if not for, the compassion and the understanding of what patients in this community needed, he wouldn't have submitted the grant application for the CPF, which is going to be game changing. I've met the folks who have already benefited from the machine. I've met the technicians who administer this new innovation that should be scaled for every woman in every community across our country. But it takes the work of a hospital, an executive team to kind of put pen to paper and make sure that happens. And so with that, I'd love to bring the CEO of HealthAlliance Clinton Hospital, Steve Roche.
I'll just start by saying I appreciate the Congresswoman's words about me, but I am the smallest cog in the wheel at our organization. It takes a team to do this work, and I don't think we were not going to be able to put an application in with all the efforts and push from the team here at HealthAlliance Clinton Hospital. So I'll start by thanking them for all their efforts. First, I want to thank you all for joining us today and celebrating this great, fantastic new technology in this community. You should know that breast cancer, unfortunately, is the second leading cause of death in women nationally. And Black and Hispanic women are more at risk than everybody else. With our own patient population here, and we have this information, we know that we have over 2,000 women who are late or need current updated mammogram in the community. But having the equipment is the first step. The second step is actually getting people to come here. So we have a lot of outreach that's going on, and a lot of support from our team here, and we will talk about them in a second. But first, I really want to recognize our guests today. We'll start and just thank Mayor Squailia for being here. For those who do not know, I'm sure nobody shouldn't know because it's been everywhere on social media, but our mayor was one of the first people to volunteer for our screening day here and did a fantastic job.
And it was my first mammogram.
And we appreciate that. And it's great just to get the message out, make sure people know that this service is available, and we do have a good growing service here, so we just wanted to recognize you and say thank you for being one of our first patients for that. Then I also want to thank Representative Kushmerek for being here. You do a lot for this community. We know you're around, you're always active, and you're really there to protect the people who live here. We really appreciate that, and certainly we've had our conversations and challenges, but I think we're working forward to get a better program for women's health across the greater region, and working towards making improvements for overall total healthcare outcomes. So we just want to thank you for your continued efforts. And now I have to talk about you a little bit. To just give a little background about the Congresswoman. So I have a lot of stuff to read here, but I will highlight a bunch of it. So Congressman Trahan, obviously thank you for coming here today, and thank you obviously for supporting healthcare. We know who our partner in DC is, and we really appreciate that. And we are here to help you in anything you need when you go forward with any other legislation going forward. So as a member of the House Committee on Energy and Commerce, its subcommittees on Health and Oversight and Investigation, Congresswoman Trahan holds jurisdiction over matters like mental health, health disparities, public health insurance programs like Medicare, Medicaid, and the Children's Health Insurance Program. Those access, that's the most important piece. Getting people access to care through these programs is where it all starts. Our new 3D mammography system is one great example. We have the equipment. Now we have to make sure people have the access. We have great people here who have gone out, pushed the program, marketed the program, are available to talk at local community events and drive the volume here. Getting people to the system and getting that screening early is the most important thing we can do as a healthcare system. Having people access this and identify any risks or concerns they might have eliminates huge issues down the road and huge costs, and unfortunately sometimes bad outcomes. So it's very important for us to work with anybody locally, our state reps, our local reps, and the federal government to find out ways that we can get people here. Screening mammography for people who do not know does not require a copay, does not require an authorization. You just need to sign up and come. We're here for you. We want to make sure you have access to that care. I also want to highlight one of the Congresswoman's recent programs that she's supporting, and that is the Reinforcing Essential Health Systems for Communities Act. And that act will help work to protect safety net hospitals like UMass Memorial Health, as well as many others throughout the country, to make sure that we have a designation that requires the federal government to know that we are essential to providing care in our communities. And there are so many programs that we can access based on that. So thank you for bringing that legislation forward. It's going to make a huge difference. Sorry, I got a few more things I have to bring up. So as we move to the earmark and the 3D mammo, obviously we talked about the event here. We have a lot of people in this room who make a huge difference for that. I do want to start by recognizing one person initially. There's a whole team behind it, but this person is really the person who's the outreach person right now. They're out pushing this program to our community, talking to the patients, trying to drive people here. And unfortunately for her, she's worked with me for many, many years, outside of UMass in the past, not just this hospital. I just want to say thank you to Betty Wateri for all she's done. recognize them. And on top of that, we do have one of our patients here today, Karen Katrukis, who she was a recent patient here, and she shared her experiences with the Congresswoman and thanked Betty personally again. It makes a huge difference, and we just wanted to make sure everybody in the community knows what we have for service and thank the Congresswoman for all of her support going forward. And we appreciate all that you do. I believe my next point is I do want to recognize Dr. Agrawal, who's going to come up and speak a little bit about breast mammography.
Good afternoon and welcome to everybody. We're physicians, and on top of that, we're radiologists and breast radiologists. We are in a dark room all day. When we look at mammograms, we don't necessarily think about inequities in terms of women's care. And if we do see something, there's not much that we do. We should be, but we don't really have the time. So we appreciate all the efforts from the technicians and the whole team that we have at UMass, which is really great and supportive. And now we're recognizing that 3D mammography is standard of care, and it should be available to each and every woman who goes for a screening mammogram. And we didn't have that, but we do have that now, and that it's such a great step, because as radiologists, when the callback rates are decreased, definitely, as the Congresswoman said earlier, the anxiety associated on the patient's part is definitely decreased by that callback. And we do see that the callback rate for 3D mammography vis-a-vis a 2D examination is about 30 to 40% less.
Wow.
That is a big number. Missed cancers, and with the FDA getting in the new rule that the breast density has to go in the letter that goes out with every screening mammography report, the percentage of women who have heterogeneous or extremely dense breast is also about 40 to 60%. And if those women are the ones getting a 2D exam, we are going to be missing a lot more cancers. We're going to be calling a lot more. So this is a big, big step. From a radiologist perspective, we appreciate all the effort that has gone on, and that we have received federal funding for something that, in my mind, as a physician, radiologist, should just be standard of care and available to every patient who comes to us, and every mammogram that we see, it should be a 3D mammogram. So we really thank you for everything that you've done to get us this equipment here. And believe me, this is not the first time you'll be hearing from us. We will be making another case for other facilities. So thank you.
Well, thank you, Steve, and thank you, Dr. Agrawal. Look, if I could sprinkle magic dust, we would just produce so many more of these machines, and we would have them in every health system across the country. But also everybody who joined us today and who supports patients in this hospital and does the hard work of delivering health care, especially today. Thank you so much for your dedication. And we never truly can thank you enough for the work that you do, but we can support it. And so I will expect many, many more applications from this hospital and so many more. But that is one big way that Mike and John and the mayor and I can support. So looking forward to coming back. But really, this was such a treat for me. Thank you so much. And now I get to hand this check that can be used over and over again. I'm kidding. I can hand this check over to folks at the hospital. Thank you so much.
Do it. 3, 2, 1.